October is a special month and it's all about campaign against breast cancer. You know, we've had interesting topics this month, and today I'm going to bring you another interesting interview. I know you are going to love it. I have with me here a gentleman who is also at the forefront of the fight and treatment against breast cancer. He is a principal radiation therapist at the oncology and nuclear medicine unit of the Kolebu Teaching Hospital. And I know you are going to enjoy this interview. He's going to take us through the treatment options available and what his department does. So don't go away. Just be here. I'll be right back.
Medcare Hub.
I'm Elsie, and I bring you another interesting topic again. My guest today is Mr. Solomon Nartey. Mr. Solomon, you are welcome to Medcare Hub.
Thank you so much.
All right.
Yeah.
Okay. Like I said earlier, you are a professional directly involved in the fight and treatment against breast cancer. I want you to tell us what are the treatment options available for victims or people diagnosed with breast cancer.
All right. Thank you so much. One thing about cancer is that cancer is multifaceted.
Okay.
Meaning that you don't have only one treatment option.
Mm-hmm.
We have a variety of treatment options. And the first one we're going to talk about is surgery.
Okay.
Yes, surgery. And then we have another one called chemotherapy.
Mm-hmm.
Then radiation therapy, where I belong.
Okay.
Yeah, so most of the time surgery takes care of, the gross tumor, which is the tumor that you can see with your naked eyes or you can feel.
Mm-hmm.
Surgery is able to take out that. Then chemotherapy is able to take care of systemic, cancers. So when you take the chemotherapy, it's able to target all other cancers that are systemic, throughout your system.
In the body.
Yeah. Then the radiotherapy is very localized, okay? Because when you do surgery cannot take all the disease away. So as I said, they take the bulk disease that you can see with your eyes. But then we have what we call microscopic ones that they cannot take out. So radiation is able to take care of those microscopic lesions so that the disease doesn't grow back, it doesn't recur. So as I said, that's where I belong, and I would say that is almost the final stage of the treatment. Though sometimes patients will do it and then go back to chemo, but then most of the time radiation therapy is at the tail end. Yes, so somebody will say, what is radiation therapy?
I was going to come to that.
Great. So basically we use radiation we target to the cancer cells. Okay. Then we treat them. So we can either use the X-ray, that's higher energy X-ray.
Okay.
Or you can use the gamma rays. I use the term higher energy X-rays because we have X-rays that we can use to even take our normal chest X-ray for diagnostic purposes. Okay. But these ones are very higher energy. They are very high energy X-rays, and then they are able to destroy the cancer cells. And one thing I want to emphasize on is that we only target the area where the disease is, meaning that we don't expose the whole body to the radiation. Okay. So it is targeted. So if we know that, okay, let's say that the disease, let's say your left breast, we only ensure that we target the left breast to receive the radiation, and then other parts of your body, we exempt it.
Okay, so in your earlier submission, you said surgery takes away the growth. I mean, the tumor we can see.
Yeah.
Then chemo also goes systemic. I mean, it goes all over the body to also
target all cancer cells. Yes.
The ones that the eye cannot see.
Exactly.
Then now radiation now focuses on the particular place that's the diseases.
Yeah.
Oh, okay.
Yeah.
Okay. So like you are scaling it down to the very minute cell that has the cancer.
Exactly.
Wow.
Exactly.
It's interesting.
Yeah.
Okay. So I believe that's what we have to know about radiation.
Yeah.
Okay.
Yeah.
What is the duration?
Okay. I would say it varies from patient to patient.
Okay.
Depending on I would say the stage of the disease, depending on the histopathology, that will inform the oncologist on the treatment regime to give to you.
Okay.
So some people do about 5 weeks daily treatment.
Average,
yeah. So that's about let's say 25 fractions. So averagely about 5 weeks. Okay. And then others to go for like 15 days.
Okay.
Others 16 days. Yeah, but all depends. If you are going for the 25 fractions, the dose you receive in a day is smaller.
Okay.
But then if you are going for, let's say, 15 or 16 fractions, the daily dose that you receive is a little higher.
Okay.
And as I'm saying, it depends on the staging, the histopathology, the behavior of the cancer cells that you have. And then that will pre-inform the oncologist on the treatment regime. So as I said, you come from Monday to Friday. Weekends, we exempt weekends, and we have reasons for that. Patients come in every day, stress and things will come in, fatigue. So the weekends will help them to rest, and also, I mean, even radiobiologically, when you are treating cancer, don't forget we have normal cells too around the area. So what you are treating, the normal cells are also going to receive some radiation. So they need time to repair. Okay, they need time to repair. So I mean, we assume that during this weekend break, you have ample time for the normal cells, okay, to repair.
Okay.
But still, the cancer cells, they'll be dormant because the normal cells, they will be able to repair faster than the cancer cells. So by the time you come back on Monday, we assume that the normal cells will be okay for us to give under radiation to the cancer cells.
We also know that some types of radiations also causes breast cancer.
Okay.
Well, that is the notion out there.
Yeah.
So if you say you're going to use radiation to treat, is it that the same thing that kills is the same thing that repairs? What's the difference between the radiation? You've said earlier that they are high. You use the high energy X-rays and also the gamma rays. So please clear this notion for us before they talk about.
Well, it's a good question.
Okay.
It's a good question. Radiation itself can cause cancer.
What type of radiation?
Any form of radiation at all. So for instance, if I talk about the X-ray, I'm talking about it can cause cancer.
The one we used to diagnose.
Yes.
Wow.
Yes. That's why I'm saying that one, the energy is very low. So unless you have several exposure before maybe the cells or the gene maybe can mutate and then all that. Yeah. But then, as I said, even UV light, this sunlight, if you are under this sunlight for a very, very long time, I mean,
you can get
I mean, the cells they can have issues and all that.
High tension. They say if you stay close to high tension,
they emit radiation. But then
telecommunication masts.
They emit radiation. But then I'm talking from the scientific point of view. I mean, evidence based. That's what I'm talking about. So when you come to us, we tell you that. I mean, even some people say even mobile phones. I mean, it's not proven. It's not proven. But we know that for X-rays and then the gamma rays, for those type of rays, if you continually expose yourself to them, you can get cancer. So back to your question.
Okay.
That's why I said that, we know the harmful aspect. That's why we are saying that in treating you, we only ensure that we come down to the area of the disease.
Okay.
So we don't expose your other parts of the body that doesn't have disease to the radiation.
Okay.
So meaning that when we are treating, we are targeting the cancer cells than the normal cells.
Okay.
But then, as I said, definitely around the region where you are treating, definitely you have some normal cells involved. Okay, that's why I'm saying we do fractionation in order to help these normal cells to revive.
Okay.
Yeah, to revive. Yeah. So basically that is that. There are other things that if I say I'll talk about, we'll just go deeper and deeper and deeper and deeper. But then basically this is about the radiation.
I'm sure this treatment has side effects.
Obviously, even normal paracetamol that you take has its own side effects. So yes, radiation treatment has side effects.
What are some of the side effects of?
Great. So depending on the type of cancer you bring, the area we are treating
breast cancer.
So I'll come down to that.
Yes.
Well, you would have the side effect, but since we are talking about breast, let me just go down to breast now. The breast, the side effect, the first one you might be experiencing is skin changes. So you realize that I said about the normal cells. So where we are targeting, we have normal cells there. So you realize that the place become dark, meaning that the cells over there will die off around where we are treating. They will die off, but these cells, they will still repopulate. So after the treatment, you realize that the darkened aspect of the body, it will peel off, and then you have fresh
skin.
Skin. Yeah, so you restore your old skin back. Sometimes we have what you call mucositis. When we treating the breast, sometimes we go as far as the neck area, because there are some lymph nodes over there that we need to cover. Those who have lymph nodes around the neck, they're positive, we need to cover. And in treating that place, you might have mucositis, that sore throat. So you realize that it will get to a point when you are even drinking water, even swallowing saliva, you feel some pain. But then we manage it for you. Since we are aware that you might be having those side effects, we have medications that we put in place to help reduce the symptoms. The symptoms. Yeah. So basically with the breast, I will say that the side effects are very minimal.
Is there any systemic side effects apart from the localized? Does a person have anything, a generalized
The
effect?
only general effect I would say is fatigue.
Fatigue.
That's the only thing I would say. And when it comes to the chemotherapy, that's where you really have generalized reactions and all that. But with the radiation therapy, no, it's not systemic. It's just localized to one portion. Sometimes to other people too can develop what we call desquamation, that is sore. So the more the radiation goes to the cells around there, sometimes turn into sore. Turn to sore. But then, as I said, we are aware of some of these side effects. The moment we see them coming up, we manage it for you. We have medications that we give the patient to reduce all those pain and all those side effects.
It's not very stressful as compared to the other treatments?
No. So it's good you brought it up. So throughout the stages, let's say surgery, chemo, radiation therapy, you have the list of the side effects.
Oh, okay.
Because surgery is going to take something out. I mean, you have to dress your sore and all that. Chemo too, that one too is very systemic. It weighs you down. But I mean, radiation therapy, our patients are able. They can even come for treatment and then go to work and come back the next day. Nobody will even know that they are even undergoing any treatment. And someone will ask, okay, you say you are using radiation. So when the person comes for the radiation and they say he's gone home or going to work, is the person not radiating other people?
Emitting the rays to
other people? No.
Okay.
As for our treatment, I mean, the moment the treatment is over in the room, that is it. The patient doesn't carry any radiation.
So it's not like an infection or something.
No. So people should clear that notion. After treatment in our room, that's all. The person just goes out, and there's no risk of the person emitting, any form of radiation for any other person to receive. That is it. Yeah.
If for one reason or if for one reason or the other, the client is not able to come regularly, maybe misses a day or two, can the person continue, or once you miss it, you have to start all over again?
Okay. So the person can continue the treatment. But our form of treatment, we don't encourage that at all. So you realize that it's only in the radiation therapy department that when patient doesn't come for treatment, we take our phones to call them to find out why they are not coming, because we know the effect. These cancer cells, they can repopulate. So the moment you start the treatment, they become more aggressive. So if you don't continue, they can repopulate. So we don't encourage that at all. But then if in one way or the other, maybe the patients cannot come and misses a day or two, we still continue with the treatment. But if the treatment duration, the person defaults for a longer period, we normally will have to review the whole treatment and then see how.
You say a longer period, like a week?
Yeah, like a week. Some people a week or two. You don't come for treatment. We have to review our prescription and see what we can do for you again. But we don't encourage patients to default treatment at all. Yeah.
That I know that cancer lowers immunity. The disease itself. I stand to be corrected. It reduces the immunity of the patient, and some of the treatments too also reduces the immunity of the patient. Radiation therapy does it also contribute to that, or that one does not affect the immunity of the patient?
Okay, so radiation therapy doesn't affect the immunity of the patient. It doesn't. That's why I said that one is very localized. Anything that will affect your immunity becomes more of systemic.
Something that goes in.
Exactly. But this one is localized, so it doesn't lower your immunity at all.
What are the survival rates of clients going through radiation?
Okay. This is a good question. It's a good question because some people say that cancer is death sentence.
It's a death sentence.
Yeah. But it's not always true. It's not always true. One thing is that cancer, depending on the stage at which you present the disease, can determine your survival rate.
Oh, okay.
Yeah. So, for instance, if somebody comes with, let's say, stage 1, and somebody comes with stage 4, you should know that we
treatment to be different.
Different. With stage 4, probably even the disease has already spread to, let's say, your liver, your lungs, and all that. So with that one, we just give you palliative care. I mean, the survival rates, I mean, we know that it's questionable. But somebody who comes early, early stage, the tumor is just very, very small. We might even decide not to do mastectomy. You can just do lumpectomy, just take the lump up, you just take some chemo, and then we give you radiation, and then you are good to go. So that one, it is just at where maybe the disease started. It is just at that particular point.
It hasn't spread to any other. That's a good news.
That's a good news. So that's why now we trying to spread the news about screenings and all that. Yes. So I mean, we should encourage our women. Though men also get breast cancer, we should encourage our women to do a lot of screening, so that if you're able to see it very early, I mean, treatment starts very early, and you are good to go. You will live till God Himself
calls you.
Yeah.
Wow, live till God Himself calls you. Yeah. But before that, you have to also come early. I think that is the key word now. Early detection.
Yeah.
Treatment saves life.
Yeah.
I think that is just the best way to go. And people have fear. They are afraid. Even with the screening, I've talked to a couple of women, and they were like, I don't want to know my status. If I don't know, I don't know. But if I know, then it's a bit worrying. You see that this disease also affects the mental state of a person. When you were talking about the treatment options, I didn't hear anything about the psychological aspects of the treatment. I know this is not your field, but I just want you to just tell us, is there any psychological help or psychological support that the clients receive in order to prepare the patient along the cancer treatment as a facility? Or is this something part of the treatment?
Okay. So I will still start from basically the surgery, because before the patient comes to us, we assume the patient has gone
through all these things.
Exactly. But notwithstanding that fact, even in our department, we have psychologists. And when the patients come, we don't refer all of them to the psychologist, but then during clocking the patient and then interacting with the patients who you think they need psychological support.
So they still need.
Yes.
They might have gotten some support initially.
Yes.
And they are still not settled with it.
Yes. The way they talk and all that, you know this person needs a psychologist. We refer these patients. So we have in-house psychologists. Not that we have to refer the patient to in the facility. We have in-house psychologists. So it helps. I mean, it's helping for our patients to know that that's not the end of the road. And I mean, we have the treatment here in Ghana. And if you are able to go to the treatment, you have your normal life back. Yeah.
I heard that this center is internationally recognized. That you get referrals from other countries.
Yeah.
As far as East Africa.
Yeah. It's just in recent times that our neighbors, some of them, they've been able to acquire radiation therapy equipment that they are also now treating their patients. But we used to get a lot of patients from Burkina Faso, from Togo, from Cote d'Ivoire. I mean, they come here. Even Nigeria, they have a lot of. Let me tell you one thing about Nigeria. They have a lot of equipment. Okay, but I'm telling you, when it comes to the workforce, because we in Ghana, we started radiation therapy long ago. So some of their patients still have confidence in Ghana. So they don't even take the treatment in their country. They still come to us for treatment. So I mean, Ghana, we are not doing bad at all when it comes to cancer. We are not doing bad at all. So we will go far. We will go far. Yeah, sure.
Thank you so much. It's very refreshing, and I've really been enlightened about this treatment option of radiation therapy. And initially I thought it was a very difficult thing, but thanks to Mr. Nartey, he has just broken it down to the minute point that it is not stressful. It is very comfortable. You can even have the treatment and still go about your normal duties. Finally, just want to have a final word with you. Just what do you have to tell our viewers? Because it's a month where we are promoting campaign against breast cancer and also self-breast examination. Just in your final words.
Great. Before I come to that, somebody will be saying, hey, so how much does it cost to to go through this treatment and all that? I've heard it's expensive and all that. The truth of the matter is that radiation therapy is a little expensive. But in Ghana, at least it's been, I would say, subsidized in a way to help the ordinary Ghanaian. Yes, but notwithstanding that fact, we have a lot of support from other companies and all that, and that's why I'm so much happy that you are here. Okay, so if we should have a lot of people subscribing to your channel, I think you are even going to be source of income for other people, people who cannot afford the treatment. I think you will be able to support them financially. So I wish everyone comes on board to help you. I mean achieve whatever you want to do. And I'm telling you, whatever you want to do is money. It's money. If you don't have the financial support, you might have the ideas and everything, but it will just be in your wardrobe. Nobody will see it. So we hoping that a lot of people will come on board, and I think myself, I'm very available. That I'm available at all times. That anything that I think I can also support you with, I think I can come on board and support you with. So let's try and fight cancer, because cancer is really killing a lot of people. Breast cancer is taking away a lot of women, and if you know the numbers, you'll be surprised. If you combine even deaths from HIV and malaria, they don't match cancer.
Wow.
Not at all. Don't match cancer, but a lot of people don't know. But today, I'm saying it. So let's try and invest more in cancer. Let's try and support the organizations. People want to fight cancer. Let's try and support them. And I think in future we will be able to get somewhere. So my final words to is that we should try and then screen the breast. The men should also help. Once you are with your wife, in a way you can. So you know your wife. The moment you see any change in the breast, you have to. Maybe she doesn't even know. You need to be able to prompt her. You prompt her and say, "Babe, it looks like I've seen something unusual."
It's good that men also learn how to do the examination.
Yeah, even if you don't learn it. During your normal routine, you know.
You should know.
Of course. You should know. You should know. So let's encourage ourselves to do self-breast examinations, and I think we'll be able to pick some of these things up as far as possible. One thing too I would say is that if you are in a family that any of your family members had this kind of cancer before, then you should know that the tendency of you also having it is very high. You should take caution. Take caution. So such people must always come for clinical examination. Every Tuesdays we do we have breast clinic here at the oncology department in Kolebu. It's a walk-in. It's a walk-in Tuesday. You can just come and then you can have access to all these facilities. Yeah. So that's that. Yeah.
Thank you so much.
You're most welcome.
Yeah, welcome.
Most welcome.
I hope when I call on you again,
oh,
you're going to get
always available. We've been doing this thing for long. I've been practicing for the past 11 years.
Wow.
So when it comes to experiencing cancer, I have enough. I would say I have enough knowledge. So always available.
Thank you.
You're welcome.
Thank you. I hope you've enjoyed today's interview. One thing stands out. Get your breast screen. Know how to do self-breast examination. Report early to the health facility. Treatment is available. A lot of research has gone into it and it's multidisciplinary. It involves a lot of health professionals. So you are covered. I know you've enjoyed it. Just give this video a thumbs up, subscribe to the channel and share. Let's share the information abroad. We have to get everybody on board. The fight against breast cancer, it is not for one person. It is a collective effort. So let's all come together and let's fight. Encourage somebody. Let's stop the stigmatization. Let's show love to those going through breast cancer. Let's also encourage ourselves to be screened. It is very important to get yourself screened. Thank you very much, and I'll come your way again. Bye bye.